Homeland Security, the men and women of the department who are working day and night, 24 hours a day to implement these restrictions and to make sure that we do this in a very orderly and efficient process. And we also continue to look at all measures on the table, new measures that we have to implement as we go forward as the virus continues to evolve. So thank you.
Thank you, Mr. Secretary. And I know the President would want me to reiterate your thanks and commendation to the dedicated men and women of DHS that are on the front lines of implementing these travel policies and doing an outstanding job. With that, I'm going to recognize Seema Verma, the head of CMS, to talk about our continued emphasis on seniors, and particularly the risk to seniors with serious underlying health conditions and the steps that we're taking relative to nursing homes and inspections and guidance to protect those most vulnerable.
Thank you, Mr. Vice President. As the President and the Vice President said, we did take action last night to indicate that nursing homes should restrict all visitors effective immediately, and that includes all non-essential personnel. There are some exceptions for end of life. We're also canceling all group activities and communal dining, and there is active screening of healthcare workers that are in the facility. The emergency declaration, as Dr. Fauci said, is also very important to our healthcare workforce. There's a lot more flexibility that they have. For example, they can have workers from across state lines, doctors and nurses that can help them. Hospitals have the ability to move patients around. So that's also going to be very helpful as they go forward with this. Also with the nursing homes, we talked about this a couple weeks ago, that we had a call to action for all healthcare facilities to double down around infection control practices. We have now come up with some very specific guidance for our surveyors, and we have already begun the process of going into nursing homes, especially the ones that we have had a history of problems with infection control. And those inspections have already started. We've been doing those in Washington State, in California, New York, but we'll be increasing those over the coming weeks. Thank you.
Thank you, Seema. And I'm mindful of the fact that there are likely many seniors in nursing homes around America that could be watching us at this hour. And let me just assure you that we're going to continue to take steps to ensure that all the guidance from CMS, all the guidance from CDC about preventing the spread of infectious disease remains low. But in the threat here, I want to be clear, as Dr. Fauci has said, and I might just ask him to emphasize again, the threat here is not to seniors, particularly, or to seniors that may be on certain medications, but for seniors with serious underlying health conditions, we're taking the steps of suspending visitors for the purpose of protecting the most vulnerable. But to all of those other seniors that are watching from nursing homes or maybe watching from home or otherwise healthy, Dr. Fauci, maybe you'd give them a word.
Yeah, sure. I think that obviously when you're a senior individual like myself, that my degree of protecting against infections is not as good as it was when you're 30, but if you're otherwise healthy senior, that the things that you really have less of a risk than if you have an underlying condition. Thank you.
Thank you, Doctor. Thank you.
Where's Secretary
Couple more updates for you. I want to hear from the Surgeon General and Dr. Carson, and then we'll go to as many questions as you have. Okay? Mr. Surgeon General.
Thank you. Yesterday was a very important day for our nation's providers and for our nation's patients in terms of the emergency declaration and also in terms of the agreement with the House that Secretary Mnuchin negotiated. And I want you all to understand some straight talk from the nation's doctor. We really need you all to lean into and prioritize the health and safety of the American people. No more bickering, no more partisanship, no more criticism or finger pointing. There'll be plenty of time for that, but we all need to hit the reset button and lean into moving forward the health and safety of the American people as our top priority. More stories on how people can protect themselves, more people on how people can get the resources that they need that we've unleashed from the federal government and state and local governments. Less stories looking at what happened in the past. Again, there'll be time for that. I want you all to understand, as Dr. Fauci said, this will get worse before it gets better, but we are making progress to flatten the curve. We are making progress. 3 important points. Number 1, almost all people will recover. 98, 99% of people will recover. People need to know that. And we heard a great story on NPR this morning about an 89-year-old from that nursing home facility in Seattle who is recovered. Number two, we must lean into protecting the most vulnerable, those with chronic or severe medical conditions, especially seniors. Now is the time for us to lean into that, and we are taking the measures to protect them at HHS. Secretary Azar, Bob Kadlec, Bob Redfield, Admiral Chirwa are hard at work right now, leaning into that from the federal level, but we need your help. Social distancing and mitigation, they're not to protect the 30-year-old or the 20-year-old from getting coronavirus. They're to protect your Nana. They're to protect your granddaddy. They're to protect the people who you love in your lives, and we need your help. And finally, we all have a role to play. If we are complacent, selfish, uninformed, if we spread fear and distrust and misinformation, this situation will last longer and more people will be hurt. But if we pitch in and we share the facts, we will flatten the curve and we will overcome this situation. So finally, my prescription, know your risk, understand your circumstances, and get the facts to protect yourself at coronavirus.gov.
Well done, John. Thank you. And Secretary and Dr. Ben Carson.
Thank you, Mr. Vice President. You know, sometimes you have to stop and think about what's unique about the United States. And one of the things that is really wonderful, and we should stop and think about more often, is that we have so many people who are willing to put aside their self-interest for the good of the nation. And I want to thank those people at the federal, state, and local level who've put their own lives on pause in order to try to help their fellow Americans. It makes a big difference. But just as importantly, I want to thank the private sector. There are so many in the private sector who have volunteered their services, who have stepped up, who are willing to recognize that maybe they're going to take a bit of a financial hit, but they recognize that we have to create the appropriate environment so that everybody can succeed in this nation. And so often we overlook those individuals. I want them to know how much we appreciate them. What we're facing now is a significant threat. You know, as a physician and as a surgeon, I faced a lot of very, very complex problems. And most of them we were able to overcome, not so much because of me, but because of the fact that we had incredible people working on this together. It was the teamwork that made the biggest difference in the world. And that's what I'm seeing here in the government right now. The people behind me with others who are willing to work together as a team to be able to accomplish the goals for the American people. And I used to think we had long hours in medicine, you know, working 24 hours straight and working at midnight, 2 in the morning. This team is working that way too. I frequently get calls at 9, 10, 11, midnight about putting together some policies, doing various things. And I just want to thank all the people who are involved. And I hope that, you know, we as a nation can use this as an opportunity to pull together for good. You know, President Trump is going to be recommending a National Day of Prayer. And, you know, we've gotten away from prayer and faith a lot in this country. There's nothing wrong with godly principles, no matter what your faith is. Loving your neighbor, caring about the people around you, developing your God-given talents to the utmost so that you become valuable to the people around you, having values and principles that govern your life. Those are things that made America zoom to the top of the world in record time. And those are the things that will keep us there too.
Thank you, Mr. Secretary. Okay, questions?
Mr. Vice President, first of all, can you explain why Secretary Azar is not here? And also, can you indicate to us, one of the things the President rolled out yesterday was a discussion of Google partnering with the federal government, and then later Google said it was not aware that this was going to be announced and that it was not prepared in the same way the President forecast to the country. So where's the discrepancy about the website, Google's involvement, And why is the Health and Human Services Secretary not present?
Secretary Azar was at the coronavirus task force meeting this morning. He's back to work, and we'll have a changing roundup for these presentations, so we can get quickly to your questions. But Secretary Azar is doing a remarkable job and working 7 days a week for the American people and making a difference. With regard to Google and other private partners, I know Google issued a statement that they are planning to launch a website. I think they gave a date of Monday, March 16th. We're working literally around the clock, and I know that our whole team working on this public and private partnership couldn't be more grateful to all of the hardworking people at Google that are helping to put this website together. But tomorrow, 5 o'clock, we'll have very specific. We'll have very specific description tomorrow about when the website will be available, when the parking lot sites will be available for people to be tested, and we're working right now with state and local communities to determine where it's best to roll those out. There's a number of communities are already doing a great job meeting their needs, so we're trying to flow the resources. But 5 o'clock tomorrow night, we'll have details. Yes, please.
Can you tell us whether you have also been tested for the coronavirus? And can you or somebody else clear up the apparent discrepancy between the letter that was issued from the White House physician's office just before midnight last night, in which the physician concluded that you and the president did not need to be tested?
Well, I know the president announced that he has been tested. And I'm going to speak immediately after this press conference with the White House Physician's Office. At this point, as of last night, the White House Physician's Office had said that neither I nor Mrs. Pence either had the symptoms or the contacts that would necessitate testing. And maybe I might ask Dr. Birx to step up. As we expand testing across the country, we want people to be able to go to a website. There'll be a questionnaire there to determine whether or not a test is in order, because we want to make sure that people are being tested that have the symptoms. But I'm going to speak to the White House physician right after this press briefing, and Mrs. Pence and I would be more than happy to be tested. Dr. Birx, you want to speak?
Yeah, no, thank you, Mr. Vice President, for mentioning that, because as I told you, in South Korea, there are 250,000 plus tests. About 96% were negative. So, and that was with symptoms. So we're working very hard integrating everything they have learned about symptoms and screening, and that is going into the development of this website. So it's not just a simple checkbox website, it's actually going to go through critical symptoms, and that's why we're giving ourselves the weekend to get it put up. So far in the United States, from LabCorp and Quest, they're running about a 99 to 98% negativity. This always worries me because I've worked in public health a long time. When you tell someone they're negative, yes, it's reassuring, but the last thing we want is them so reassured that they stop practicing these critical practices that are going to protect all of us. This epidemic will be stopped at the community level. Those are the individuals, it's Americans, and their response that will get us over this hump. And that's why, yes, we'll have testing available. We'll have to know that many are going to be negative, and you're going to have to help us carry that message that means just at that moment you're negative, you need to continue to do all of your protection and protection of others to ensure you remain there.
To follow up on the Google question about the website, Google said that the website they are developing is in its early stages and will be limited to the San Francisco Bay Area. That seems very different from what you and the president are saying.
Well, what Google said was that they're planning to launch a website this coming Monday, March 16th, that will enable individuals to do a risk assessment and be scheduled for testing at pilot testing sites in the Bay Area, with the goal of expanding to other locations. And we're very grateful for that. The objective here is to have a website up very quickly that first people in the areas that have been deeply impacted, Washington State, California, New York. Now we've seen community spread in Massachusetts and also Florida. And so we want to make sure that we're flowing those resources as well as those remote testing sites in that area. But that's a statement I was handed this morning from them. And again, I want to tell you folks, we're working 24/7 on this. We're going to have very specific details on the rollout of this new public-private partnership in testing at 5 o'clock tomorrow. Please.
Mr. President, thank you, Mr. Vice President. Could you give us more details on the potential financial assistance for the entertainment industry, for the cruise industry that the administration is looking at right now? And if I may, on the temperature checks, were all of the members of the cabinet who were in here today, did they also have their temperatures checked? And, okay, I see you nodding, but is it also the White House policy now that anyone who, for instance, comes into the Oval Office needs to have their temperature checked at the door?
I'd refer those questions to the White House Physician's Office. I have been informed that they're establishing new protocols for temperature checks, and I had my temperature checked too. Let me ask the Secretary of the Treasury to address what may be the next few innings. I mean, as I thought Secretary Mnuchin put it very well. We got the initial support, $8.3 billion from the Congress. The House passed legislation to act on the President's priorities, but we understand the President's made it very, very clear, whether it's our airline industry, our cruise industries, that we expect to be coming back to Congress to make sure that as we put the health of America first, and as businesses make those hard choices to make a priority of the health of their employees or of those that they serve or their customers, that we're going to make sure that they can come all the way back. Mr. Secretary?
So let me just emphasize that this is a unique circumstance. This isn't like the financial crisis where people didn't know how long this was going to go on. And let me just say, there's no question, because of the things that we're requesting people to do, there are parts of the economy that are shutting down or slowing down dramatically. And as I said before, and I said yesterday, we are committed to use all the tools and all the resources of the government to make sure that we protect the economy. So many of the industries that you've talked about, as I said, the airlines are the most obvious because we have a unique circumstance where we have shut down travel, and these are of strategic importance to us. But we appreciate there's many industries that are impacted by this. I would also say there's many individuals. The President has talked about a stimulus program, whether it's through a payroll tax cut, whether it's through refundable tax credits. We are 100% committed, and I can assure you there is bipartisan support. So we have a lot of tools. The Fed has a lot of tools. Some of these tools we don't have that we had in the financial crisis. We'll be going back to Congress. And one of the reasons why this bill was so important is this is just now the second step on bipartisan support. We will make sure that the economy recovers out of this and whatever support.
Sir, how much more money, if I may follow up, how much more money would you like to see? I'm not talking about the previous bill, I'm talking about in the future for those industries.
Let me just comment. It would be premature to comment on specific money, as I said. I'd use the analogy of we're in a baseball game and we're in the early innings. We have 100 different things that we're looking at. Yesterday, the President announced on student loans, suspending interest. That was one of the things. He announced using the strategic oil reserve. This is a great time. We also have a unique circumstance having nothing to do with the coronavirus. Parts of our economy are very much impacted by the temporary low price of oil. So the President, the Vice President, and everybody else is 100% committed. We got 100 different ideas, and whatever we need to do, we will do.
Mr. Vice President, thank you so much. I have a question for you, and if I can, for Dr. Birx. First for you, sir, if I may. Your language has changed a bit. You've tweaked it a little bit. Early on, you said that there was a low risk for the average American to contract the coronavirus. Right. Recently, your language has altered a little bit. You're saying the risk of a serious illness remains low. Can you address why the change? Is the potential of contracting the virus for an average American no longer low? Why the change, sir?
Well, I'm going to let Dr. Birx address that, because the reason we're...
Which, sir, and you are the Vice President, if you don't mind, sir.
Everything that we are communicating to the public is based on what is the unanimous opinion of our health experts based upon the information that we have at the time. It's now a little more than a few weeks since we had our first instance of community spread in the United States. and letting the American people know the President took every step to prevent the coronavirus from coming into our country. I think you can't overstate how unprecedented and extraordinary the suspension of all travel from China was when the President made that decision before the end of January. And the travel advisories with portions of Italy, South Korea, the screening of personnel coming into our country. But allow me to let Dr. Birx address that, because what we're going to continue to do is tell the American people, straight from the health experts, the best information that we have to see to their own health, the health of their family, and their community. Dr. Birx?
Yeah, thank you, Mr. Vice President. So every day we analyze data from around the world and look at age groups that are impacted, look at and try to get a sense of the amount of asymptomatic patients. Now remember, all of the groups that are doing screening are screening on symptoms. And so we're trying to figure out, based on that information and based on the profile of the epidemic, to really understand, is there a whole group under 20 that really doesn't get significant symptoms, yet we don't believe that uniquely people under 20 are naturally protected from the virus. So are they a group that are potentially asymptomatic and spreading the virus? Because of that, and because of that unknown, we don't want to say that the risk is low when we don't know how low the numbers are for people who are asymptomatic. We have a good sense of the number of people who are having symptoms, and we have a good sense of who is deeply impacted by this. I mean, if you look at all the data coming out of all of the countries that we triangulate on a twice-a-day basis, people of a certain age are at higher risk for a worse outcome, and that's why we have been so laser focused on that. But the other side of the epidemic is how much transmission. And until you really understand how many people are asymptomatic and asymptomatically passing the virus on, we think it's better for the entire American public to know that the risk of serious illness may be low, but they could be potentially spreading the virus to others. And that's why we're asking every American to take personal responsibility to prevent that spread. And that's why we've made all of these recommendations broad, even past people who have symptoms or no symptoms, because we need to have everybody taking precautions.
All right, last question. So you said tomorrow you're speaking to all of the governors. Are we
Monday.
Oh, Monday. I'm sorry.
Yeah.
So we're going to speak to all the governors. Are we looking at any sort of domestic travel restrictions that could be coming down the pipeline anytime soon? And my other question for you is Leader McConnell's statement saying that he was going to read the bill, that he was going to speak to some of his members over the weekend. Are you confident that the Senate's going to take up this House legislation and get it done quickly?
Well, the President expressed strong support for the legislation. It received a very large bipartisan vote in the House. But we respect the process. I'm grateful for the support that Leader McConnell has expressed for the process and the priorities that the President has outlined. We'll be working with members of the Senate to unpack the bill for them and why President Trump endorsed it yesterday, and we believe that they should move it expeditiously to passage.
And on domestic,
With regard to additional travel restrictions,
in the U.S.
let me just say, as the President said, we're considering a broad range of measures, but no decisions have been made yet. But I just want to assure the American people of two things. We're going to continue to follow the facts. We're going to continue to listen to the experts about recommendations. We'll bring, as we did this week when the President made the decision to suspend all travel from Europe, we'll bring the best recommendations of our healthcare experts to the President. And I promise you, and I promise the American people, this President is going to continue to take every step necessary to protect the American people and put the health of the American people first. And together, we'll get through this. Thank you.
What's being done to help those in public housing during this coronavirus? What's being done to help those in public housing? Is anything being done? A lot of things are being done. A lot of things are being done.